It's good. It's a good thing.
It is. Okay, you're right. It is. It's a good thing.
It's a good Is this real life?
I don't know.
Is this happening?
I don't know.
What the hell are we gonna do?
Google it.
All right, we gotta take this seriously.
We can do this.
What was that place that your girlfriend told us about?
Healthy Star.
Healthy Star.
Something.
Healthy Star Coalition. Is that? Yes, this is
yes,
definitely
that's it.
Oh, God bless, God bless.
That one.
Yeah. Oh my gosh, awesome.
Thank goodness.
About us. So yeah, we should totally get into contact with these people. Oh, their address, their phone number.
Perfect.
Oh my God, we're good to go. We're good.
Woo! Yay.
Oh my God. Okay.
Awesome.
We need to get into contact with these people ASAP. Hello, sir. Nice to meet you. I'm John.
Hey, I'm Dr. Lincoln.
Nice to meet you.
Hey, I'm Dr. Lincoln.
Nice to meet you.
We are expecting a child. It's happening.
It is.
It is happening.
That sounds so fun, so fun. I remember my first time having a child, and that's why I really came here. My name is Dr. Lincoln. I'm the director of Healthy Start Coalition of Orange County, and today I'm just going to be giving you guys a basic understanding of things we can do to help you guys improve as parents, and things that are complicated to the new parents of the world. So I have a video for you guys to watch, and I hope you guys enjoy it. So here it goes.
Oh, awesome.
Governor Lawton Chiles had the legislation passed. He sponsored it because he was very interested in the high prematurity rate in Florida. So the law passed, and the law says that each county in the state of Florida will be covered by a coalition. So there are now 32 coalitions that cover the 67 counties, so that the whole state is covered. We're the only state in the United States that has universal coverage for maternal child health.
Quite an accomplishment.
It is an accomplishment, especially when usually I say Florida because we're so far behind on so many things. But that is actually one thing that we have to be proud of. So the 32 coalitions, the Orange County Coalition stands alone. We haven't joined with any other coalitions because we have obviously one of the highest birth rates in the state. We have almost 17,000 births a year here in Orange County. Our mandate is to do a screening of every woman that's pregnant at her first appointment with her OB. And then again, she's screened when she gives birth at the hospital or a birthing center or anything like that. The screen is basically a social inquiry. Did they plan to get pregnant? How do they feel about being pregnant? Have they ever felt like they were in danger? Are they hungry? Are they homeless? Are they overweight? Are they underweight? That kind of thing. If you score at risk, you're automatically contacted by the Healthy Start program. If you don't score at risk and you still want some help, you can request to be come into the program, to be eligible for the program. I mean, anybody can join is what I'm saying. But if you score at risk, we're going to contact you.
Okay.
And tell you what our services are. The higher the risk, it's sort of a triage kind of a program. The higher risk you are, the more intensive care we give you. We have standards and guidelines that come out from the State Department of Health. So we're told, depending on your risk, how many times we have to come and see you, whether it has to be in person or on the phone or things like that. Last year, we screened almost 90% of all of the women that gave birth in Orange County, which is a very high percentage. Women can refuse to take the screen, but they usually don't even know they're taking it, frankly, because it's given to them in a stack of papers on their first appointment. You know how you go to a doctor and they hand you that. So most women don't even know that they've been screened unless they're called. We have about 55 care coordinators that are assigned, women are assigned to their caseload, and they go to the homes and visit them. The higher risk they are, get home visitation. Some of them we just contact on the phone starting out saying, do you need anything? We have a daddy boot camp here that we formed several years ago that there's more and more research that shows the importance of fatherhood. And we have obviously a lot of, well, over 40% of our moms aren't married when they give birth. So what we want to do is make sure that when the dad's excited about being a dad, whether they're going to stay with the mom or not, we need to let them know how important it is for them to stay in their child's life, whether they're going to stay in the relationship or not. Because that has a lot to do with early literacy. I mean, all the research shows that women are more likely to breastfeed, they're more likely to read to their children, they're more if the dad's involved, and if the dad is encouraging those kinds of things. So we got a grant from United Way. Sorry, I got a frog all of a sudden. To start that program, we got a license that Florida Hospital paid for us. To start, and we are now the fastest boot camp for new dads program in the country.
Wonderful.
So we have, I don't know, probably half a dozen a week, the 3-hour workshops. Most of them are done in the hospitals, but we do go out in the community, and we've done it at, like maternity shops and stuff like that if they want to sponsor one, and at apartment complexes and stuff for, ones where there's, especially if there are a lot of single dads and so that's become very popular and a real important part of our program, and we've seen a lot of good results with that. The boot camp, also, it's a national model. Actually, it's an international model now that was started by the military, and it was started in order to get dads to realize the importance long term of their child staying in school and not being involved in juvenile justice and all kinds of things like that. But what they've really shown is that it bonds the dad to the child, so he knows that even if I'm not with the mom anymore, I need to stay involved with the child. And we give them a workbook and things, and the key of the program is that veteran dads come back and they bring their babies, so the dads that are going through it have a dad who's got a child under the age of 1 there with them, so they can practice changing the baby, they can hold the baby, they can see how that dad reacts with the baby when the baby's crying and that kind of thing. And no women are allowed, so they can ask all kinds of questions that they wouldn't ask in a normal group. So that's been a big thing that we've done. We also have a program called Save Our Babies that is for racial disparity in birth outcomes because of the black issue that I mentioned before, the black women being 2.5 to 3 times as likely to die in their first year. We found that most black women didn't know that. Almost all of them knew that someone who'd had an infant death in the neighborhood, but they hadn't put it together with all the other stuff, so they didn't know that. So what we've done is we've hired outreach workers to go out into the community in targeted zip codes with a large number of African Americans and talk to them about it and what they can do to prevent that. Like making sure that if they're planning on getting pregnant, that they go to the doctor first and make sure they don't have any chronic diseases like diabetes or things that they would need to get under control first, or make sure they watch their nutrition and make sure they keep all their doctor's appointments and things like that. So that program has been grant funded and been used as a promising practice nationally for informing black women and helping them understand their risks and what can be done about it. We also have a partnership and have been one of the founders of the Central Florida Partnership for Health Disparities, which started through Florida Hospital because of that, because we've done so much in the racial disparity in birth outcomes issue. If you look at all the research, that's true in almost every health factor for blacks. I mean, they're much more at risk for diabetes and heart disease and cancer and on. Every single risk factor is higher for African Americans. So we joined together all of the groups that are working on those kind of issues and have been trying to educate the community about that as well, all their risk factors, not just maternal child health issues. So that's been another big factor of things that we've been involved in. We have baby showers periodically, usually 2-3 times a year, the big community baby showers where we get sponsors, and all of our pregnant moms come and we give them lots of information, but we also have games and giveaways and things like that to try and get them educated while it's fun.
Right.
So we're involved with that. We're involved with the Children's Health Insurance Kid Care. We have that under our office here. We're in charge of Kid Care for Orange County, actually for the Tri-County area.
With Osceola or Seminole?
Seminole,
Okay.
and is it Osceola, or I'm not sure whether it's Osceola or Brevard. That's the third county. We have somebody that heads that up in the office. So we're in charge of making sure that people are telling people about the fact that their children may be eligible for health insurance and what that difference would mean. We also have a grant for Affordable Care Act navigators. In the office, we have 5 health navigators that work for us that go out and explain to people what signing up for insurance through Affordable Care Act means and how much it will cost them and what plans they're eligible for and that kind of thing. So that's also under our auspices in the office.
Wow, that was a lot, but you know, whew, got a little weight lifted off my shoulders, just like understanding what you guys are all about, because one of her girlfriends told us about you guys and we weren't really sure like what to do just after finding out this huge life-changing thing that's happening in her life. But you know, honestly, after that video, like that like helped us a lot. Like we just kind of want to like understand a little bit more about like some of the programs you guys do in order for us to just like feel a little bit better with this whole process that's going to be a couple months. But we just wanted to know like something about like I understand you guys help her a lot throughout her pregnancy, but I'm over here like I'm not pregnant, I'm just being here for her. Do you guys offer any like programs for the dads to like try and like be more educated?
It's going to be okay. You know, here at Healthy Start Coalition, we have a lot of programs, you know, to make you a better father. One being Daddy Boot Camp. You know, we have a lot of guys come in and they show you things that you can do to become a better father. You know, like basically like changing diapers, or you know, like milk, you know, things like that. Like as a father, you really want to know how to do that.
Wow, that is awesome to hear, because that honestly sounds like I need that at this point, and that just sounds like it'll be a great program. But as far as my wife's concerned, I think that she has a few questions about her pregnancy as well, just as I did. But do you have anything you can think of right now?
I just had a quick question regarding like C-sections. I don't know what your policy or what your advice is regarding that, because my mom actually received one.
Yeah, that was like a big thing.
So I just didn't know like what you guys thought about that, or if that's even good or healthy.
Here at Healthy Start, we care way more about the health of the baby than having a baby at a set time like schedule. We recommend that you have your baby naturally, you know, full term. We don't like to see babies come from a C-section because it causes a lot of frustration or complications with the parent or with the baby. So we would rather you just have a natural birth.
All right, yeah, that's good to hear. We saw that in the video that you just showed us earlier with your other correspondent. She was saying that, and that was just something that we we talked about a couple weeks ago. Just something that got brought up of all the nervousness of being pregnant. But that's good to know. Thank you for letting us know about that.
Thank you so much.
No problem, guys. You know, that's my job, you know, to ensure you guys are happy and make sure your baby comes out healthy and have no problem. So, is there any questions you guys have?
Actually, I just thought of it a couple minutes ago. Her girlfriend was telling us something about like the happiest baby.
Oh, yeah.
Remember her saying something about that, like relating to sleep, and like I don't know, that literally just crossed my mind because I love my sleep, and like obviously I'm gonna love my baby, but at the same time, like, is there something you guys have with that, or?
Yeah, actually we have Happiest Baby on the Block. You know, that's a program to show your baby, do things to make sure your baby, you know, goes to sleep whenever your baby is being fussy or there any problem, you know, your baby can go to sleep quietly.
The right way to handle that situation.
Yeah, the right way, not be abusive or anything.
Oh, no.
So, right. So the healthy way, you know, to make your baby go to sleep and, you know, the basics.
Oh, that would be awesome to learn.
Great.
So no problem.